Welcome to Head and Neck Questions and Answers, Batch 3. Let's begin. A 45-year-old female with history of hyperthyroidism presents to the ER complaining of fever, tachycardia, anxiety, and diaphoresis. What is the best treatment? Propanolol 40 to 80 milligrams every 4 to 6 hours. Which lab value would indicate hypothyroidism? Elevated TSH. A 20-year-old male presents with significant facial trauma, diplopia, and gaze disturbance after a motor vehicle accident. What is the diagnosis? Rectus muscle entrapment secondary to orbital fracture. A 40-year-old female presents with her face pulling to the right, flat left nasolabial fold, ptosis of the left eyelid, and flat left forehead while wrinkling the right. What is the diagnosis? Bell's palsy, which is a 7th cranial nerve deficit. Right-sided headache with ipsilateral rhinorrhea and lacrimation. What is the diagnosis? Cluster headache. Left-sided throbbing headache with nausea, vomiting, and photophobia. No neurologic deficits. What is the diagnosis? Migraine headache. What is the most common form of vertigo? Benign paroxysmal positional vertigo. Which vertigo is associated with displacement of calcium pebbles in the middle ear? Benign paroxysmal positional vertigo. Painful vesicular lesions are noted on the tympanic membrane in a patient with recent upper respiratory infection. What is the diagnosis? Bullous meningitis. How is bullous meningitis treated? Macrolide. A 4-year-old child presents with a seal-like barking cough, hoarseness, and stridor. What is the diagnosis? Croup. What is the most common cause of croup? Parainfluenza virus. What is the preferred treatment in moderate to severe croup? Nebulized racemic epinephrine. A 6-year-old boy presents with drooling, dysphagia, and distress. He is sitting with hands on the knees and neck extended with open mouth. What is the diagnosis? Epiglottitis. What is the most common cause of epiglottitis? Haemophilus influenza type B. What is the single most important aspect of treating moderate to severe epiglottitis? Intubation. Otitis media is an infection in the middle ear. What is the most common bacterial organism? Streptococcus pneumoniae. Which is the second most common pediatric diagnosis in the emergency department? Otitis media. Which examining method is most reliable in confirming the diagnosis of otitis media? Pneumatic otoscopy. A 75-year-old female presents with unilateral facial pain described as shooting pain. What is the diagnosis? Trigeminal neuralgia. Well, thanks for completing this batch of questions. I do hope that you will like, share, and subscribe. I wish you well. Good night.